Hello, today we have a patient who's interested in having liposuction. We're going to go through the procedure, the risks a little bit with her and talk to her about why she wants to do it and the areas that she's concerned about. Hello, how are you?
Good.
It's good to see you. You're interested in maybe liposuction?
Yes.
Okay. How long have you been interested in that?
Years.
Okay. And what particular areas are you wanting to have liposuction performed?
I'm interested in my stomach, my love handles, and the back of my thighs.
Okay. The back or the side of the thighs?
The side of the thighs, I guess.
Okay. Sometimes we call those the saddle bags. It's very common in women to have a little bit of extra fat there. Now, how much do you weigh?
About 126.
And what's your ideal weight?
About 120, at least 115.
Okay. Do you eat healthy? Do you exercise much?
I'm very active. I eat well. I work out in the gym, and I do a lot of sports. So I'm actually in pretty good shape. I just cannot get rid of these certain areas.
It sounds like you fall under the category of having isolated deposits of fat you can't get rid of through diet and exercise, which is the perfect candidate. You know, this is not a weight loss procedure. It's really good for people who already have their diet and their exercise routine under control, because if you don't have that, then chances are you're going to lose the fat, pay a lot of money, and you're going to gain it back. So that makes you a good candidate for it. It also won't help, you know, skin if it's very saggy. I haven't seen your skin, but it's not good for that either. But as far as the procedure goes, it takes, you know, 1 to 3 hours depending on how many areas you want to have done. The more volume you take out over a certain limit, it can be a little bit more dangerous. So I'll talk to you about the volume that you have and how much you want to take out.
Okay.
After surgery, you have to wear kind of an ugly girdle for about 3 weeks that keeps the swelling and the bruising down.
Okay.
And you'll notice an immediate difference after surgery, but it's going to be 6 months before you see the final result. It'll get smaller and smaller and smaller.
Okay.
One of the things about fat is, you know, your body has these little fat depository sites where it prefers to deposit fat, and women usually get the fat deposited in the buttocks and the thighs, and men usually get it in the abdomen and the love handles. I mean, it's different for everybody, but those are areas that are very that liposuction is commonly performed on. I know we've gone through some of the risks of the procedure and complications. Do you have any questions that you'd like to ask?
Yes, I brought a few of them because I have so many. How long will the surgery take?
It takes about 1 to 3 hours depending on how many areas that you have suctioned, really.
Okay. How bad is the bruising and swelling?
You know, that's really variable. If you have bruising, it's usually gone by 2 weeks. Okay. Certain areas may bruise a little bit more than others. The inner thighs sometimes bruise a little bit more than the other areas, but you know, often there's not much bruising at all.
Oh, really? Okay. So. How long until I can get back to my to work, I guess, my normal routine?
It really, again, depends on your pain threshold. It's not one of those procedures I think is really uncomfortable, but some people, you know, feel like they got hit by a car. Some people feel like there's not, you know, it feels like a heavy workout. I would say that you could probably expect to get back to a desk job in 5 to 7 days. Okay. I'd want you to stay out of the gym for probably about a month.
That's what I was going to ask. No, okay.
Because that will increase your swelling. Even though you feel like going, it'll increase your swelling, and it may cause a little bit late bruising.
How long will I have the swelling for?
Well, you're going to be swollen for 6 months, but most of it's going to be gone in a month. Okay. But it slowly goes down more and more. Usually what happens is the first month you come in, you're swollen. Your bruising is gone by about a month or by 2 weeks, and you know, by a month you still have some areas that are a little bit numb. They feel firm underneath the skin, and there may be some asymmetry. One side may be a little bit more swollen than the other. You may have some little contour irregularities, those kind of things, and then it just gets better and better.
If it's asymmetrical, or what can you do for that?
Okay, as far as asymmetry, everybody's asymmetric from one side of their body. Everybody's different. So what I do is I try to measure that before surgery and try to even that out. Okay. I carefully measure how much fat that I take out in the canister, so I kind of keep it the same if I need to keep it the same. But often one side of the body will swell a little bit more than the other, and it just takes a little bit longer for that to go down. So it may be that you'll look and there'll be more swelling on one leg than the other, or something like that.
How common is, because I've heard one of the, how common is rippling?
The most common problem associated with liposuction is contour irregularities or rippling that sometimes can look like cellulite. And under really close scrutiny, you can find that in every single person that's had liposuction. The chance of it being like, oh my gosh, bad problem, can't live with this, can't correct it, is much, much, much less, but it does exist. And certain areas of the body, I think, have a higher risk of having rippling and waves than others, but that's the most common problem associated with liposuction.
Okay.
The reason why that happens is if you're going underneath the skin with the tube and the cannula and sucking out the fat, you can get a little gentle wave from doing that. And then as the body's healing and you have the garment on, it's almost like wet cement in a way. And if you push or pull or lean on stuff, and it can also help create some contour regularities doing that.
How painful is the aftermath of the recovery of the procedure?
It's different for everybody. I think generally it's easily controlled with pain medication that you take by mouth, and but some people complain a lot more than others.
Okay. What about, I'm not so concerned about weight loss, but inches loss. I mean, what would the difference be?
Can't tell you how many inches you're going to lose. Definitely you'll lose volume. You won't lose much weight usually from this, but you'll lose volume, and the range of how many inches you can lose is pretty wide. If there's a lot of fat there, you're probably going to lose a lot more inches. But I can't tell you you'll go from a size X waist to a different size X waist. We can't predict that.
Right, okay. And will the fat come back into the places that have been liposuctioned?
It could. Again, what you have is certain fat sites that your body prefers to deposit fat, and generally you put the fat there first and you take it out last. That's the last place it comes away from, or the last place that you lose your weight. And so if you take out the fat, you still have some fat cells left, and you can still gain some weight there. But I can't tell where you're going to gain your weight, because there's a genetic predisposition for you for where your fat's going to be held, and so I don't know.
Okay.
Depends on how much you eat too.
What medications should I take before the surgery and after, I guess?
We're going to give you some antibiotics to take, as well as you'll have a sleeping pill and pain medications. We don't want you to take anything that might cause any bruising and swelling, like aspirin products, and we have a list of those medications for you.
Okay. Okay. I think that's it. What about my skin afterwards? Will it be saggy or?
No.
No?
You shouldn't have saggy skin. You're young, and your skin should snap back and be fine. I'll take a look at you when I examine you, but I think you'll be okay with that. Now show me what areas you're thinking about losing a little weight in.
Okay.
Having the liposuction performed.
In the back here.
You want to lose a little bit right here.
Right.
Okay.
The left handle here.
Just a little bit right in here.
Right.
Okay.
And then the abdomen.
Okay. So what you're wanting to do is take out just a little bit right here.
Right.
Okay, because you look like you're in good shape. You don't look like you're overweight, which is really good. We'll take out a little bit here, and then a little bit right here. This is a very common area, and then a little bit back here. Is that right?
Yes.
Okay. And your skin has got good elasticity. I think that's gonna go back fine.
Okay, great.
These are pictures taken in the operating room after liposuction has been done on the left side only. Both pictures are of female patients who have had liposuction performed on the left hip and left inner and outer thigh, but not yet on the right. The black lines made with a magic marker identify the areas to be suctioned. You can see an immediate decrease in volume and improvement in body contour. Obviously, the right leg was suctioned after this picture was taken. This is a picture of a male who has had liposuction performed on the right love handle and not yet on the left. Again, you can see an immediate reduction of the size of the love handle. This is a sample picture of a canister after fat has been removed. The total volume is approximately 1.5 liters. The yellowish material is predominantly fat, while the darker red fluid is blood. You can expect to lose more blood with larger volume liposuctioning.
Today we're here with our patient who has had liposuction performed about 6 weeks ago, and she had liposuction in her stomach and her hips and her thighs, and we're going to check in with her to see how she feels and how the recovery period was. How are you doing?
Good.
Glad you came in today. I want to talk to you a little bit about the recovery period now that surgery's been done 6 weeks ago.
Okay.
How painful was that liposuction procedure?
It wasn't that bad. I did take Vicodin for the first couple of days, so I think that helped a bit, but I just basically stayed in bed and watched TV and some movies.
Okay, was there one area that hurt worse than the other?
The stomach hurt a little bit worse, but again, I think that's just because getting up and out of bed is what I did for the first couple of days.
Okay, and most people will tell us that the thighs don't hurt too much.
No, didn't feel that at all.
How much bruising did you have?
Barely any, just a little bit in the thigh.
And usually the bruising kind of works its way down, and
Right,
sometimes
that's what I think happened.
Right, sometimes you say, well, how comes at my ankle it didn't do anything there, but the bruising can kind of work its way down with gravity.
Right.
Was there any surprises or anything unexpected about your recovery period that you'd like to share with me or others that are thinking about the surgery?
No, I didn't like the girdle a whole lot.
Okay. Was it hard to put it under clothes?
It was just hard to put on.
Okay. And how long did you wear that girdle?
Well, it was funny. I wore it for 3 weeks, which is what you recommended. And at the end, I didn't want to take it off.
Right. Because it felt like a
It
little
did
bit
feel good after a while.
more support. All right, let's talk about some markers here as far as time. How long did it feel comfortable for you walking around the house after your procedure?
Oh, by day 3, I was up walking around.
Okay, and how long would you feel like getting back to a desk job?
I think I was back at work by day 6.
Okay.
That was fine. I just wore the girdle.
Wore the girdle. How long would you wait before you felt comfortable walking around a mall?
Oh, within a week I was walking around.
Okay.
The mall and everything else.
And then, of course, the working out was 3 weeks is what you
Right.
told us because you went, hiking and everything.
Right, I did a light workout, but I was back at the gym.
What changes did you notice in your clothes, like your pants? Did you go down a pant size? Were they looser or?
Most of my pants are definitely a lot looser. I do have a couple outfits that I have gone down a size on.
Okay.
Getting back into my old clothes.
And this is only 6 weeks, and you're not going to see the final result for 6 months. So I usually tell patients don't go out trying to buy clothes because what you buy at 2 months is going to be loose on you at 4 months.
Right.
Unless you're eating, all the food you can.
No, I haven't bought any new clothes, but what's nice is I'm fitting into my old ones that I haven't been able to fit into in a long time already.
That's good.
So
That's great.
I'm happy with that.
Are you happy that you had liposuction?
Yes, I'm really happy.
And what about the procedure made you the happiest, or what changes have you noticed?
Well, aside from the size of my clothing going down, my stomach is flat, so I can hardly wait for bathing suit season.
Okay, great. Well, thank you for coming in.
Thank you.
These are the before and after photos taken of the patient in this video following liposuction. On the far left is her before photo. The middle photograph shows the markings made just before surgery, indicating the areas where fat would be removed. The photograph on the right was taken 6 weeks after surgery to give you an idea of the general appearance you might expect at that time. You can see a nice improvement, especially in the inner and outer thighs. It is important to know that at this stage, she is still very swollen and will continue to decrease in size significantly over the next 4 months. These are the same type pictures taken of the abdomen before and after her surgery. Although the improvement is very noticeable on physical exam, it is harder to see from these pictures. The picture, however, may help you in understanding what you might look like 6 weeks after surgery if you were considering wearing a bathing suit or other clothing. This is a close-up photo of a sample scar from liposuction at 6 weeks to give you an idea of what you might expect at this time. These scars generally are red and raised in the beginning, but fade out over the next 4 to 6 months.